I'm joined now by Rick Crone, who's the president of HealthSense and also the author of mHealth Innovations, Best Practices from the Mobile Frontier. Rick, thanks so much for joining us. Now HealthSense is right in the middle of mHealth. Give us an idea of how the experiences of your company translate into the innovations that you talk about in the book.
I've been in healthcare technology for about 14 years. I started out in hospitals, and I felt even early on in the 90s that technology was going to be part of a solution set for healthcare sales. I went into healthcare technology with the idea that there was a whole range of solutions that could really solve health's problems. And I've been a healthcare generalist up until about 2 or 3 years ago when I started on focusing on mobile, because it was really starting to percolate to the surface as a real bright opportunity. I've written for HIMSS for about the past 12 years on emerging technologies, written on mobile healthcare exclusively for the past 3. HIMSS asked me to write a book on mobile healthcare to introduce its membership to the topic because it was still a bit hazy at that point. In 2012, the book that I had written with my co-editor David Metcalf was produced at this conference. It was well received. It served as a nice introduction, and it helped HIMSS establish its footprint along with mHIMSS in the mobile space. On the strength of that book's reception, HIMSS asked us to produce a follow-up volume, whereas the first book was an introduction to mHealth. The second book was really oriented towards proof points. What's working in mobile healthcare? How do you separate the hype from the actual reality? What we've done in this second book is we've asked contributors, and we have many, to provide us with case studies and thought leadership pieces that would demonstrate the value of mHealth. And we think we've done that. The book is being produced. It's come out at the conference today. But my experience as a healthcare IT consultant working in mobile healthcare really informs that book, because I found that mobile healthcare, whether it's in the United States where there's a ready access to web access through mobile devices, to emerging markets where there's simply nothing more than voice and text, mobile healthcare can have a dramatic influence on the way that people experience healthcare and the way that healthcare can impact people's lives. So in the US, we're working on things like devices that integrate with wireless infrastructures to help people with chronic disease management. In the emerging world, we're working on simple SMS text messages that might help a woman who's pregnant more capably manage prenatal care, or might help people educate themselves about malaria prevention and clean water, or might help people just ask a question of a doctor who's 400 miles away. So there's a lot of different ways that mobile healthcare can implement, or can be implemented and can impact the healthcare of entire populations. And that's what this book is intended to demonstrate.
So you're getting into the efficiencies, the metrics of utilizing and incorporating this in not only traditional medicine, so to speak, but also a good business practice.
It is, and although the business model, or the sustainable business model for mobile healthcare has yet to reveal itself, what we're saying is, and we use this as sort of a point, a mantra almost, in both our books, is that mHealth is not simply a disruptive force in healthcare. In many cases, we believe it's going to be a displacement force. So it's going to really implement or impact the way that people experience healthcare. It's all about the consumer at the solid center of the healthcare continuum. It's all about translating, the patient, or recasting the patient-provider dialogue, making healthcare less reactive, much more proactive, and much more inclusive.
Rick, thank you so much for joining us.